Good afternoon. I think we're going to get started. Thank you for joining us. This is the very first webinar hosted by the UConn Center for Health and Social Media, and I am Dr. Sherry Pagato, a professor in the Department of Allied Health Sciences here at UConn, and the director of the Center for Health and Social Media. I was very excited that our first webinar was in partnership with the National Library of Medicine, and so we're going to be talking about how the National Library of Medicine can be a resource for anybody who's working on developing mobile health apps. So just some housekeeping to start off. Let's see, the webinar is being recorded, and so we'll have a link for later. We also have the option to view captions for the event. If you click on the URL in the chat box, you look over the chat box, you'll see a URL. You can click on that if you would prefer to watch through captions as opposed to the audio. If you have a question during the webinar, feel free to shout it out in the chat box, and we'll probably be going for about 45 minutes and then open it up for questions. Okay. Okay. So when advancing the slide, sorry about that.
So I think we have to click in here.
Okay. Okay. Alrighty. So for some introductions, like I said, I am Dr. Sherry Pagato, and we have Susan Halpin from the National Library of Medicine. She is an education and outreach coordinator housed at the University of Massachusetts Medical School in Worcester, Massachusetts. I thought I would kick us off by talking a little bit about commercial health, mobile health apps. There's been a lot of research on health apps that are available in the marketplace, including a study that we did a few years ago, but several other studies looking at the commercial marketplace as it pertains to a particular area of health, so obesity, physical activity, arthritis, stress management, smoking cessation, and so on. And these papers reviewed a number of apps that were in the marketplace to figure out to what extent do they reflect the evidence, so either evidence-based strategies or evidence-based information and so on. And the common denominator across all of these studies, one of the common findings, I should say, is that most of the apps were pretty light on the evidence. And so this is a challenge because we have so many resources out there, but they're not necessarily bringing evidence to the users. So what we would like to do is kind of be able to push this space forward, not only on the commercial side, but of course on the academic side, as we know that there is a lot of work going on in terms of developing health mobile apps in academic research labs. Is there any problem with audio?
No, I can see the chat box.
Oh, okay.
So,
I need you to click on my slide. Okay. Yeah, right. Okay. So some ways we could incorporate evidence into apps might be have the app deliver an evidence-based behavioral strategy. So for example, in a lot of apps, we have self-monitoring as a popular example of an evidence-based strategy employed in a lot of apps. There's also a behavioral change taxonomy that has been the work of Susan Mickey's group. And what it does is create a collection of numerous behavioral strategies that have been tried and true in a lot of studies in the research literature. And so that may be a place to go to look for evidence-based strategies. Another way to bring evidence to your protocol, to your app, would be to explore the strategies used in evidence-based protocols. There are evidence-based protocols for a number of behavioral issues, like obesity, smoking cessation, stress management, and so on. So that might be another opportunity to incorporate evidence into your app. So that's focused kind of more on behavioral strategies. Another way to bring evidence into the app is through evidence-based health information. Many health apps actually provide health information in certain aspects of the app. Could be in a library section of the app, could also be through pop-up messaging and so on and so forth. So the challenge there is, where do you find evidence-based information? The big question is, what is an evidence-based resource? Is it vetted, up to date? So this is where the National Library of Medicine comes in, because this is what they do, is they bring together all kinds of evidence-based health information resources. And so that is what Susan is here today to talk with you about. So our purpose is to introduce you to the National Library of Medicine and all of the basic free resources that they provide in their website through databases and tools, and why these resources might be better than commercial websites such as WebMD, where you see lots of health information being pulled together. So we'll also demonstrate how NLM resources carry out the mission to improve public health, which is a mission that we all share, and provide some examples of how these health-related resources can add value to your app if you're working on developing an app. So I am going to turn things over to Susan Halpin to pick it up from here. And like I said, if you have a question, feel free to add it to the Q&A section, and we'll definitely get to it in the last 15 minutes or so. Here you go, Susan.
Thank you, Sherry. Hello, everyone. I'm Susan Halpin from the New England region of the National Network of Libraries of Medicine. And I'm excited to be telling you all about the great resources that the National Library of Medicine has. We all have been hearing a lot about fake news and alternative facts over the past year or so, and being able to trust information you receive from a website or a database should be based on evidence or facts. That's essential, especially when you're communicating to other people. So that is the best selling point that I want to share with you about the resources from National Library of Medicine, or NLM, is that all of their online resources are trustworthy. They have been written by experts in their fields. They have been peer-reviewed, and they're current. Healthcare professionals especially need to keep up with the ever-increasing stream of information, new guidelines, new medications, medical literature, all while they're seeing patients. And there are many types of resources that can help healthcare professionals stay aware of new information while they're delivering evidence-based care. However, not all resources are high quality and have reliable factual information. So healthcare professionals, as well as consumers, need a strategy to weed out erroneous information and to locate reliable sources of unbiased information. So using the National Library of Medicine site, databases, and tools that you'll be seeing today can be that strategy. So the article that's on this slide is from a 2017 Cleveland Journal of Medicine article. The title is "Staying Afloat in a Sea of Information, Point of Care Resources." And in that article, they identify what makes a resource good for communicating medical or health information. So ease of use, links to original articles, freedom from advertisements, evidence, not just expert opinion, ease of access, and disclosure of conflict of interest. And I have to say that I think that the National Library of Medicine resources meet all of these criteria for being really good resources to use. So I wanted to just give you a little background about NLM. There actually is a physical National Library of Medicine. It's located in Bethesda, Maryland. It sits on the National Institute of Health campus. It's the largest biomedical library in the world and one of the federal government's largest providers of digital content, and the library is open to everyone. As I told you, I'm the Education and Outreach Coordinator for the New England region of NLM. So I promote the digital resources, as well as develop and teach webinars and other educational classes and professional development opportunities. So each of the regions has, pictured in the slide, has their own website where you can access the calendar for classes and other events. Each region also has a blog and a weekly update, and anyone can become a member of the network of the National Library of Medicine. The network is free. The New England region currently has about 6,500 network members, and being a network member enables you or your organization to participate in our training classes, receive assistance in partnering with another organization if you are looking to carry out a project, and it also enables you to apply for funding grants. I think that the entire network nationally has about 6,800 members. Further on in the presentation, I'll talk a little bit more about grant funding opportunities. So some of the NLM resources that you've heard of or know may be PubMed, which is a literature database that contains about 27 million citations and abstracts for biomedical literature from life science journals and online books. You can use PubMed to search for answers to questions or for research on particular topics. The other resource that you may have heard about is Medline Plus. It's a website for patients and their families. It has information about diseases, conditions, and wellness issues in a language you can understand. It is written for the everyday person, not just healthcare providers. It offers reliable, up-to-date health information anytime, anywhere, and again, it's free. Everything that I'll be talking about today is free. You can use Medline Plus to learn about the latest treatments, look up information on a drug or supplement, find out meanings to words, view medical videos and illustrations. You can also get links to the latest medical research on a topic you want to know more about, or you can even find out about clinical trials or a disease or a condition. So NLM partners with public health organizations such as the Agency for Healthcare Research and Quality, the American Public Health Association, the Medical Library Association are just a few of them. The public health topic pages help the public workforce find and use information quickly and effectively on any of the following subjects: bioterrorism, dental public health, HIV/AIDS, nutrition, obesity. The main topic pages have information about public health workforce data, health data tools and statistics, health promotion, health education. And there's a button down at the bottom in the center, and that is one website to search several different databases. So if you click on that one search, it searches the HSR-PROJ, HSRR, HSRIC, and PHP partner sites. Partners and Information Access for the Public Workforce is a collaboration of U.S. government agencies, public health organizations, health sciences libraries. Let's go to the next slide. So, why would you want to use NLM resources? I'm sure many of you have had the experience of Googling a topic only to be returned a long list of search results and, finding out that a lot of the search results have nothing to do with what you were searching for, or if you did get results that were pertinent to what you were looking for, you actually had to do some investigating to make sure that the information you received was reputable, current, and wasn't just one person's opinion. In this example here of a WebMD site, it's often hard to recognize what is the ad in a site and, or I should say on a commercial site, and what is the real information that I was looking for. So the two circled items are ads here on WebMD. They also specify that under sponsors, they have regularly sought sponsorships and advertisements from relevant commercial organizations, manufacturers, and other leaders dedicated to providing health and lifestyle information. The National Library of Medicine doesn't have any advertising on their site at all, and all of their sites have been written by experts who don't have any financial stake in the website. Okay, so here is an example of the Medline Plus website. So it's designed to help you find appropriate or authoritative health information. Medline Plus provides access to information produced by the National Library of Medicine and the National Institutes of Health, from searches of PubMed. Medline Plus database also indexes medical research, literature, and clinicaltrials.gov, which is the database of clinical research studies conducted by NIH and many other institutions worldwide. Medline Plus also provides you with a database of full text drug and supplement information, an illustrated medical encyclopedia, a medical dictionary, and the latest health news. In addition, Medline Plus contains pages that link up to other websites. For example, health topic pages for over 1,000 diseases and conditions from Alzheimer's to Zika. And the focus is on organizing publications produced by NIH institutes and other federal government organizations. Medline Plus also links to other websites, ones with unique information or special features, such as diagrams, glossaries, or formatted pages that are tailored to particular user needs. Those are just some of the quality guidelines that NLM uses when they decide what links they want their sites to link to. So it's about quality, authority, and accuracy of health information. Also, to any other organization that NLM links out to, the mission has to relate to the goals and the intended audience of NLM, or I should say Medline Plus in this instance. So that organization must provide accurate science-based information that complements or enhances the government information found on Medline Plus. The source of the content is established, respected, and dependable. CV. I'm sorry. Yeah, I think that really just concludes how NLM decides what health content it will link to. NLM makes almost 300 databases and online services freely available through libraries to anyone with internet access. You can also get to any of these databases and online services through any computer connection. This slide is a promotional flyer that contains links to some of those sites and databases. The link to the right is the link to the PDF file that you would be able to print out yourself. NLM databases and websites that contain, NLM databases and websites contain current peer-reviewed and expertly written information. And one thing I should mention is that all of the links in this presentation, once you get the copy of this PowerPoint, which you'll get with the recording link, you can actually click on these links. I purposely made them live, so it would be able, you would be able to easily go to some of the places that we explain in this presentation. So if you're a mobile health developer, some of the resources that you might find helpful are Medline Plus Connect. So Medline Plus identifies some materials for patients to access from electronic health records. These materials are usually short overviews of diseases, conditions, and therapies written for patients in an easily printed out format. The materials must also meet existing quality guidelines. So when you implement Medline Plus Connect, it makes a global change. You don't need to create individual links. It accepts information requests based on coding systems already used by EHRs. It supports the HL7 context-aware knowledge retrieval info button standard. It also supports requests for information in English or Spanish. You don't have to use Medline Plus Connect exclusively to link to patient education information. Many EHR systems can be configured to link to more than one source of consumer health information. The next few screens that you're going to see are helpful tools that consumers, I think, would be really interested in using. And these may be things that your mobile app would like to connect to. So this tool is DailyMed, and this site provides trustworthy information about marketed drugs. The drug labeling on this website is the most recent submitted to the Food and Drug Administration and currently in use. It may include strengthened warnings undergoing FDA review or minor editorial changes. These labels have been reformatted to make them easier to read. The drug labeling on this website may not be the labeling on current distributed products or identical to labeling that's approved. Other information about drugs may also be available. NLM regularly processes data files uploaded from FDA system and provides and maintains this website for the public to use in accessing the information. Additional information about medicines is available on the Medline Plus website. So when I was preparing this presentation, I did want to give you an idea of what you would see if you were to put in a drug to the DailyMed site. So I put in Adderall as the drug that I was searching on, and you can just see some of the search results that came up. There are different types of Adderall. So I chose to learn more about Adderall XR. So the slide on the right-hand side is what information comes up when you choose a drug from a search. So some of the things that you see are the dosage and administration instructions, the different forms and strengths of Adderall XR, warnings and precautions, adverse reactions, drug interactions, use in specific populations, and even some information about drug abuse and evidence. This next tool is called Pillbox, and this would be useful if you came across a pill, say on the floor, and you didn't know what this pill was. Pillbox could help you. You would fill in some of the fields, or as many of the fields as you can. So on the Pillbox form, so say was there an imprint on the pill? What's the shape? What's the color? What's the approximate size? And our next slide will show you what comes up in the search. So when I did a search, I really just filled in the shape and the color fields, and it returned with many choices. So that's the screen on the left-hand side, and I wanted to see what information I could get if it correctly identified the pill that I found. So I clicked on the very top picture, and it returned with showing me that the name of the drug, also to the active ingredients. I'm sorry, inactive ingredients, the product code, DEA schedule. Things like that. The National Library of Medicine is a leader in global disaster preparedness and response report. So the tools on this slide are designed to provide mobile device users to access web-based content. So one thing that I haven't said previously is that NLM has apps already developed. So a lot of the disaster resources and emergency preparedness information is in the form of apps to make it easier for first responders to use. They have been developed to run on iOS platform, Android, and also BlackBerry. So some examples of disaster preparedness or first responder information that you can get, hazardous, I should say, or websites that you can get to through these apps are CBRNE and hazardous substances, responder support and safety, psychological health tools, U.S. federal organizations, the American Red Cross suite of apps, surveillance and alerts, family reunification, apps for disasters in libraries. This next slide is an infographic that I put together because I wanted to give you an idea of how extensive the health topics that the National Library of Medicine has information about. So this infographic is about trending health topics. So if you're looking for credible information about trending health topics like mental health, complementary and integrative medicine, multicultural, minority and refugee health, environmental health and disaster preparedness, even pet health, food, nutrition and fitness, K through 12 education and career exploration, and even clinical trials in your city or state, genetics, pregnancy, and breastfeeding. So, for example, if you are looking for the most current information about your pet's health or about addiction, opioids, and toxicology, NLM will have extensive information for you. So this slide is the first link that I clicked under the addiction, opioid, and toxicology category on that infographic. I found that there seems to be a lot of interest given the current health crisis with opiate addiction. So there's a whole portal that NLM has put together so that all of the information about addiction and treatment can be found mostly in one place. So some examples, since the print is kind of small in these slides, are, or some examples of information you can get are understanding addiction, opioid overdose, medications to treat opioid addiction, opioid prescribing, pregnancy, opioid and neonatal abstinence syndrome, recovery, data, trends and statistics, understanding addiction, some reports like the Surgeon General's report on alcohol, drugs, and health from 2016, the report from the Office of the Surgeon General, vital signs, opioid prescribing, where you live matters, videos from the Surgeon General, information about easy to read training courses from the National Institute of Drug Abuse, the White House Commission on Combating Drug Addiction, and the opioid crisis. I think that was a recent report. Say you're very interested in nutrition because your mobile health app has to do with nutrition. So if I wanted to find out more information about that topic, I would first go to Medline Plus, looking for basic nutrition information. And I don't know if you can see in the slide here, but there's also a Learn More section, as well as a Research, More Resources, and even nutrition information for specific populations. Even if I were interested in finding videos or other tools about nutrition, there's a section on videos and tools in the subject header. Some of the examples of other nutrition sites that NLM links to are myplate.gov, FDA.gov. You can search PHP partners and also get some nutrition-related resources. One of the first search results that I received when I did a search on nutrition in PHP Partners was a NLM training course called Food for Thought. Let's see, trying to just see what other things you would be interested in here. There's information about nutrition, physical activity, and obesity, data, trends, and maps from the Centers for Disease Control and Prevention. All right, I think that, oh, here we go. Healthy People 2020, NIH charts, a path for nutrition science. There's a link to Healthy People 2010 Information Access Project, a link to the Supplemental Nutrition Assistance Program, a link to Nutrition and Obesity Genetics and Genomics, and actually the American Society for Nutrition is also one of the links that comes up. So say you were interested in finding some resources that provided evidence for your act related to physical activity and exercise. Medline Plus would be a great place to start. It has information in 40 different languages, depending on the page of the site, depending on the page of Medline Plus you're on. All of Medline Plus information is translated into Spanish as well as being available in English. But depending on the page, there can be a variety of languages offered that the information is translated into. And in total, Medline Plus has about 40 different languages in its entire site. So when we did a search on physical activity and exercise, the search returned information from many different organizations. Such as the American College of Obstetricians and Gynecologists, National Center for Health Statistics, the National Multiple Sclerosis Society. Those are just a few. So you were interested in some resources on mental and behavioral health. A good place, again, would be to start with Medline Plus. In the screens offered here in this slide, I did a search on teen mental health. You can also click on Medline Plus has a news section, and it will give you the current information about teen mental health that has been in the news. Another place that you could start is from the NLM homepage and just put teen mental health in the search box. So that's what I did in the top right-hand picture. So NLM has many of its own databases and websites, but it also returns search information on a topic from external agencies. So all of the information that NLM links to externally are trusted sources. In our next slide, this is the gallery of all of the mobile apps NLM has developed. And this is also a promotional flyer that you can print out. So there are mobile apps on, you know, HIV, AIDS, drugs and medical devices, consumer health, toxicology, actually even there's an embryo pregnancy app where you can actually see an embryo develop through each month of pregnancy. So these are just two examples of the apps up close for you to see. So the AIDS Info app provides information about federally approved HIV/AIDS medical practice guidelines, HIV treatment and prevention, clinical trials and research. The app on the right is the LactMed app, which provides information about maternal and infant drugs and dietary supplement levels, the effects that drugs have on lactation, and on breastfed infants. And it also provides alternative drugs to consider if the drug that you're using does have an effect on your baby. So again, this is a screen that basically gives you a listing of all of the promotional materials that you can have access to. These would be especially handy for healthcare providers if you had a patient who wanted more information on HIV/AIDS or actually even agencies who wanted to know minority health resources. There are one-page flyers that you can print out. So as I said at the beginning of the webinar, that NLM provides grant funding. It's on an annual basis, and it funds grants for projects and programs that use NLM resources in innovative ways to further the mission of improving public health by providing access to good, credible health information. So the funding categories and the amount of money can change slightly from year to year. This slide is an example of the grant funding categories that the New England region offered. Different, depending on where you live, you may be, or where you work, you may be in a different region, and those regions will have their own grant funding categories. So the amounts also will be a little different. But in our region, there usually is a request beginning around February to alert people that grant funding is available, and they will start accepting applications from programs and agencies. And the grants begin at the beginning of May, and they usually are year-long grants. There are some that are different, but for the most part, a year-long grant. So the work would begin on May 1st and go till April 30th. So what I'm going to show you next is a 5-minute video from one of the organizations that received grant funding from the New England region. The organization is the Petaway Pursuit Foundation, which is a nonprofit organization that provides certified doulas who are focused on improving pregnancies, births, and postpartum experiences. Petaway's unique program called Doula by My Side is designed to educate and empower expectant mothers through each phase of their pregnancy. And in case you don't know what a doula is, it's a woman caregiver who provides non-medical assistance before, during, and after childbirth. A doula also provides assistance to the expectant mom's partner and family. They also provide information and emotional support so that those improved maternal and birth outcomes will be seen. Okay, all right, so, yeah, so I'm just going to show you, I think I'll start at the beginning and then, and we'll have to speed it up because we are running short.
Executive Director of Halpin, who provides services and by families of visitors with the I received a call from a social worker that was aware that I had been and she called and asked that was also flagging that my parents, my survivors, would benefit this month. That was the first time I realized that this is something that is for the public. We were mentioned tomorrow throughout the pregnancy, all we have to do is part. So we're with our moms, educating them on what to expect on their birth. We also give them information and resources of how to maintain and release something. So they can actually take on it and stuff like that. One of our doulas, I was a friend that told about it, told about it, that we should put in for. That's why I said it. And that's why we did it.
My name is Carmen Taylor. I am the administrator for Petaway.
Okay, I'm just going to speed this up just a little bit.
NLM is that we are providing an innovation of the mobile technology.
So we provided funding for the handheld tablet that the doulas are using to educate the expectant moms.
We received it, about the opportunity.
All right, I'm going to stop it here just because I do want to have time to answer questions. So, just NLM resources are a win for both developers and users. Because of the credible information and sites. And both developer and user are able to improve their health literacy and expand their knowledge of health and medical information through the site's databases and tools. So as I said, outreach is provided through the network. And benefits of NLM network membership are training, whether it be webinars or events, grant funding. Okay, so I hope this has given you some ideas about how you can use NLM resources And hopefully you have some ideas now about how it would add evidence and value to your mobile health app. So why don't we start looking at questions.
There's a couple of questions I see. The first one by Carol, I want to make sure if you conveyed all articles in the NLM databases are peer-reviewed. One can select articles that are peer-reviewed, but I'm not sure if all of those in PubMed are peer-reviewed. Can you respond to that?
You know, something I thought they all were peer-reviewed. That's my understanding, but if I'm wrong about that, I will let you know.
Yeah, that's my understanding as well, but there, I suppose there.
Yeah, I don't know if there are exceptions.
Yeah, I'm not sure. And then the second question, does the NLM network promote its resources? For example, the flyers, which may be handy for healthcare providers to share information, resources seem very helpful. This seems helpful to physicians who may have limited time with each patient.
Yeah, so that's my job for the New England region, and there are people like me all over the country promoting these resources. So these flyers are available to anyone, so yes, anybody can print these out. But if you have found this information helpful, please feel free to pass it on, and when you receive the presentation, you know, you're welcome to, you know, take this information and give it to anyone you think would be interested in knowing about this.
Another question, how have the apps been evaluated to ensure that those with low literacy can use them?
Again, I don't know a lot about the app development, and I have to tell you, I haven't extensively used the apps. I have them installed on my phone, and I've looked through them, but I do know that NLM is very aware that their apps need to be, they need to be appropriate for audiences. So I do know that health literacy is one of their NLM's big, I guess, priorities, but I don't know specifically how they've been evaluated.
Somebody had made a comment that the materials in Medline Plus are designed at the 8th grade level, and other apps are designed to meet the literacy needs of their target audiences. So thanks for that.
Yeah.
That comment, that's helpful.
Yeah, so, you know, the resources that are, that I didn't even touch on that, you know, perhaps researchers or highly healthcare providers who have areas of expertise that are highly specific, those resources are written for that audience, and things like Medline Plus and, you know, hopefully some of the other resources that have been developed for consumers hopefully are appropriate. I mean, I feel like they are appropriate for the audience.
And I suppose investigators could take some of these materials, and if they needed to tailor them to certain audiences, could they work with NLM on doing this? So if there were some materials that needed tailoring to a specific audience that, I don't know, might have hearing impairment or other literacy issues or any number of things, was that something that they could work with NLM?
Yeah.
To make modifications?
And again, I can't speak for NLM, the national, but that's something that is very important to NLM, is that whatever resources they have improve public health. So if people are finding that maybe the resources could be improved in some way, I think NLM would welcome that feedback. I don't know of specific programs right now that NLM is working on to address that, but perhaps there are, and I don't know about it.
So another question is, can app developers customize the existing apps provided by NLM, or do they have to be used as is? So again, is there an opportunity to work together on what's already been built? Or has anyone done that, or is that a possibility?
You know, as far as I know, I don't know of an instance where an app developer has worked with NLM, but that's something that I did want to bring up because I thought that this was a new area, a new audience to reach out to, to let you know about the resources and, you know, kind of expand who we're promoting these to. You know, a lot of librarians know about NLM resources, and that has been a very big audience of ours for a very long time, but I think we're really wanting to start going out to perhaps people who we haven't marketed these to before. So I think that's starting.
Right, and one of the purposes of this webinar was actually to make people aware of these resources in case they were useful, since they're so expertly developed. Were there any other questions or thoughts from our listeners? We have time for another question or two, if there is one. If not, I hope that was useful, and like I said, we will have a link if you need to revisit or pass this webinar along. We will circulate a link to you all, but feel free to follow up with us if questions come along after the fact as well. And yeah, I mean, use your library as a resource for sure, but also feel free to contact us.
Yes, and just so you know, when we do send out the recording and the presentation slides, there's a little bit of work we need to do on our end just to get things into a format that's useful to you guys. So it does take me a couple of days, so just know that you won't get this information tomorrow, but perhaps early next week would be the time frame.
Sounds good.
So thank you so much for taking the time to join us today. And yes, if you have questions, we'd love to hear from you.
And as the last thing I'll say is next month we do have a webinar that is going to be on using social media for behavioral intervention development. So please stay tuned. Look for that. Follow us on Facebook. Follow us on Twitter. We'll be having some monthly webinars on these and similar topics.
Great.
So, thank you.
And you know what, one thing that I forgot to mention, I was having trouble getting our evaluation link up on the slides in time for the webinar. So I'm going to be sending out the evaluation link probably later this afternoon. So any feedback you have, we really would love to hear about it. Any questions you have, you can also use that forum to ask them. All right, thank you. Goodbye, everybody.
Thank you.